Thank you for joining me. This discussion will be about bypassing phonemic awareness for children with persistent decoding problems. I'm Jan Norris, and I'm an LSU professor with a lifelong passion for improving learning outcomes for children who learn differently than the typical auditory classroom learner. For this, I have received the American Speech Language Hearing Association State Clinical Achievement Award 3 times, the National DiCarlo Award for Clinical Achievement, and the ASHA Certification of Recognition for Special Contributions in Higher Education. I've published articles, books, book chapters, and intervention materials related to both preschool age and school age students. I am the developer of Phonic Faces and other materials to assist learners that will be discussed in this presentation. Our agenda for today is to create a logical understanding of decoding and how to make it easier to learn. We will establish the definitions for basic terms associated with the alphabetic principle. We will establish the importance of phonemic awareness for learners with decoding deficits, including dyslexia. We will look at attempts to develop alphabets to facilitate learning when plain print fails. We will look at the role of speech sound awareness, including the LIPS program. We will explore phonic faces that serve as a missing link between phoneme and grapheme awareness, including the outcomes of studies. I will provide you with a free PowerPoint so you can explore learning with your children or students. So let's begin. Our first topic is, what are phonemes? Sounds are vibrations that travel through the air or another medium and can be heard when they reach a person's or animal's ear. Speech sounds are specific sounds produced by the tongue, teeth, lips, palate, voice, and oral and nasal cavity, that is, the organs of speech, that produce audible vibrations associated with spoken language. Our chart shows that sounds like p, b, w are made at the front of the mouth using the lips, while sh and v use teeth to move the air past the lip. T and d tap the teeth, while s, z, sh, n, and o vibrate air at or near the alveolar ridge right behind the teeth. Other sounds like k, g, or h are made further back in the mouth. This understanding will be important to our later discussion, so remember this diagram. Phonemes are the smallest unit of meaningful sound within a specific language. These categories are cognitively constructed during early childhood, primarily in the left hemisphere. Our knowledge of letters and sounds exists here and not on the printed page. But we can use materials that make learning easier for children or adults learning to read. So what are graphemes? Objects are material things that can be seen and touched. Light waves bouncing off of objects travel through the air and can be seen when they reach a person's eye. So whether we are talking about auditory signals or light signals, they both travel in wave patterns. Letters are the objects with specific shapes used as symbols, usually written or printed, to represent the speech sound and constituting a unit of the alphabet. Pre-symbolically, letters are merely shapes. So I have a diagram here that shows, could be an art project, where they look like letters to somebody who understands letters, or they just look like shapes. Graphemes, on the other hand, are the smallest unit of written language, whether or not it carries meaning or corresponds to a single phoneme. These categories are cognitively constructed during the early childhood years for those with exposure to print, primarily in the left fusiform gyrus and surrounding cortex. This area is important prior to associating the shapes of letters with phonology or semantics. So that little red area is going to be critical to organizing and storing our knowledge about letters. or graphemes. So what is letter-sound association? Letter-sound association is a term used to refer to the identification of sounds associated with individual letters and letter combinations. So we talk about children learning their letter sounds. It's actually a misnomer. The alphabetic principle requires more than rotely learning to produce a sound in response to the letter shape. That low-level response can just be a memorization, but in order to read, we need to have an understanding at a much higher level, at the cortical level. Okay, so that requires phoneme-grapheme association. These are cognitively constructed representations of sounds or phonemes and letters or graphemes, and the neurological links between them. At first, letters are constructed as objects, just like a ball or a stick, without any special associations to a sound, as shown in red. So when we look at our picture of our cortex here, at the back of the cortex where the eyeball is, that's where we process visual information. Visual information comes in and the actual shapes are organized. So at this point, they don't have any meaning. The circle that represents the letter O looks just like the other circles. There is no differentiation between them. They're just shapes. However, once letters are linked to phonemes in the heteromodal superior temporal cortex, they are reconstructed as symbols for sounds or graphemes, as shown in blue. All right, so now they are meaningful and they make a difference. So P and Q are now seen as completely different symbols. As graphemes, they are linked to words. Now they inherit all of the existing information about the words or lexemes to which the phonemes are connected. So as soon as a letter becomes the grapheme, then the grapheme is associated with the phonemes. So the graphemes elicit the sound that they're associated with. Sounds are linked to words, and now graphemes become linked to words through their connection to phonemes. As a vocabulary word, each lexeme has access to all the semantic, syntactic, and conceptual knowledge used for communication. So now the grapheme is hooked to the phoneme is hooked to the word has all of this knowledge about the concepts, the syntax, the semantics, and everything that we need for comprehension. So now when words are read, they are processed as language and comprehension exists. And so now we have a network where everything is integrated. And our little red area where at first the visual information comes in is now activated throughout the system. All right, so that's going to, allow us to form the alphabetic principle, which is basic to reading. The structure of reading in English is based on the alphabet. So to reiterate, once graphemes link to phonemes, the phonemes provide the gateway to accessing words. This link enables the alphabet and orthographic system to be constructed over an extended time period. So this begins typically in kindergarten or even before and goes on until grade 3. So this orthographic system is now going to be much more than the alphabet. It's going to be the entire system of spelling. So how do we spell words with short vowels? How do we spell words with long vowels? How do we create syllables? How do we create prefixes and suffixes? That entire system has to be constructed. And so it takes many years to accomplish this. But it begins with the alphabetic principle. The alphabetic principle refers to the predictable and systematic relationship between letters and spoken sounds. When I see a B, it should say the B sound. When I see the S, it should say the S sound. According to the alphabet principle, Letters and combinations of letters are symbols used to represent the speech sounds of a language based on systematic and predictable relationships between written letters, symbols, and spoken words, which brings us back to the lips, tongue, alveolar ridge, and the palate that we looked at earlier. The alphabetic principle is the foundation of any alphabet writing system, including English. So we are actually representing with print the way that we speak or the sounds that we speak. As a vocabulary word, each lexeme has access to the semantic, syntactic, and conceptual knowledge used for communication. Thus, when the system is integrated, words that are read and are processed as language. As a vocabulary word, each lexeme has access to the semantic, syntactic, and conceptual knowledge used for communication. Thus, when the system is integrated, words that are read are processed as language and comprehension results. When the system is not integrated, word recognition, fluency, and reading rate and comprehension may be disrupted. So, in essence, reading is a failure for the multiple complex systems to integrate and function as one cohesive unit. So what is phonemic awareness? I'm sure all of you have heard that term. Phonemic awareness is the ability to notice, think about, and manipulate individual sounds or phonemes in spoken words. So I'm going to put a little cortex up here. So there's our brain. And now we're going to put a metabrain on top of it. So when we talk about phonemic awareness, we're not talking about the concrete brain. We're talking about the brain that can think about its own content. So manipulating the sounds of a word include being able to isolate, blend, delete, or otherwise change words. Your meta language can think about abstractions. So here's my concrete brain. It has an association between a dog and the sound that the dog makes. The dog says woof. But at the metacognitive level, now I can take the abstract word dog and I can say the word itself can have sounds. And the first sound of the word is duh. A learner who has acquired phonemic awareness has a pathway to learning the alphabetic principle. If one is aware of the first sound in a word, then pictures of a word that begin with a letter make sense. D is for dog really means D is the letter we associate with the duh sound. D is for dog makes no sense to a child who does not have phonemic awareness. Dogs don't look like the D, they don't bark, duh, and the print doesn't look like a dog. So if you don't have the phonemic awareness, then you're sort of stuck at that level of the concrete brain. And so all of the things that the teacher is talking about to help you understand the alphabet don't make any sense. And this relationship of D is to dog just confuses the child. Dogs don't look like a D, they don't bark, duh, and the print doesn't look like the dog. So what is phonemic awareness and its relationship to dyslexia? Here's the type of alphabet that we were just talking about, where there is no direct relationship between the picture and the sound. Apples don't say ah, bears don't say buh, cats don't say k. So in order to understand this relationship, you have to say, it's not the object apple that I'm talking about, it is the actual word apple. So you have to forget about the meaning because the meaning of apple will only confuse you. You have to treat the word as an abstraction. And then the word itself is what you're now going to break into parts. And that's called phonemic awareness. Well, lack of phonemic awareness is a hallmark characteristic of dyslexia. Children and adults with dyslexia have poor ability to segment words into their constituent phonemes and to manipulate these units. This difficulty renders typical alphabet associations confusing and does not assist them in learning the alphabetic principle. These deficits lead to difficulties in reading, decoding, including accuracy, consistency, and fluency. In severe cases, difficulty decoding persists into adulthood. This has led to numerous attempts to develop alternative alphabet letter sound associations to facilitate learning the alphabet principle. So let's look at a few of these. Object and action picture letter sound associations is a common approach. These are the ones that you see in word walls in every classroom, and you also see them in many of the worksheets and activities that children are expected to do when they are learning letter sound associations. So an example of the first type is a picture of an object and its associated letter. So we see the letter P and we see the pig. The task is to say P and listen for the sound in the word pig. Well, pigs say oink. They don't say P. And so this is a very confusing request for when a child does not have phonemic awareness, because in order to do this task, you have to treat the word pig as an abstraction and pay attention to the word and not the animal, and then listen for the parts of the word itself. Example of a second type of picture is one that is based on action. The task is to say to represent the action of puffing out the candle. Both object and action pictures helped kindergarten children remember the letter sound when looking at the pictures. In the study, the results were significantly better than a no picture or an irrelevant picture. But neither picture type improved recall of sounds at post-test with letters only. So when the kids did not see the pictures, they really couldn't say the sound associated with the letters. Without phonemic awareness, the association doesn't make logical sense and thus does not generalize to plain print. The next study combined letter shape plus letter sound. So we have three different types of shapes here. Type 1, the letter shape pictures look like the letters, but they had no association to the sound. So the F does look like that candy cane, but candy cane starts with the K sound, not the F sound. The second one is the type 2 picture. Pictures are associated with the sound, but not the letter shape. The shape of the B does not look like any letter, but the sound that the B makes does resemble the sound of the letter Z. Zzz. And then the third type is a picture association with both the letter shape and both the letter shape and the sound. So the shape of the snake looks like letter S, and snakes hiss like the S sound. S. So in this study, they had 8 children who were 4 to 5 years old. Following training, they produced the sound in association with the picture significantly better for type 3 pictures that showed both the shape plus the sound. However, the transfer to plain print letters was not tested, so we don't know if they could recognize the sound in response to the printed letter S. So the next attempt came in a study by Dakyel and Al-Rub, which combined letter shape plus letter sound plus printed letter. Type 1 pictures that they used associated both the letter shape and the letter sound. So the snake looks like the letter S and the snake hisses like the letter S. Type 2 used pictures associated with both the letter shape and the sound, but they also added the printed letter. Type 3 used letters associated with the picture beginning with the letter sound, but not the letter shape. The participants in this study were 90 children with learning disabilities. They found that type 1 and 2 letters, where the letter shape and sound were combined, resulted in better letter sound learning than type 3, with a sound association only. And then Type 2, with the printed letter next to the pictured letter, resulted in significantly better letter sound learning than the same picture without the printed letter. All right, so we've learned a new thing now, that the study agrees that a sound association was the least effective when the letter shape looked like the letter and there's an associated sound. Those were easier to learn, and the ones that generalized to print the best were the ones that also had a printed letter. The last attempt we will look at is parent reading books and eliciting letter names and sounds. So the attempt was to establish letter names and letter sounds in the context of a book rather than word cards or letter cards, so that children could learn to read in the context of reading. In a study by Heather Halsey, 31 parent-child dyads were randomly assigned to 32 sessions, 4 times a week for 8 weeks, for either an alphabet or a storybook reading condition. The storybook reading condition was the control condition. Both groups were given scripts. Alphabet book scripts included letter naming, letter sounds, picture naming, and phoneme awareness tasks. The storybook scripts included picture naming and action labeling. The results for children showed that only picture naming improved regardless of the book condition. So even though the alphabet books were practiced in including letter naming and letter sound naming, that those skills did not improve at the end of the study, only picture naming. The results for the parents showed that at post-test reading, the parents asked more questions about letter names than they did at pre-test. So parents did catch on to being able to ask about letter names while they were reading the book, but they did not ask questions about letter sounds, despite being trained on the importance of the techniques for eliciting these responses. This approach to letter sound learning was found to be ineffective. Remember the study because we will contrast it to another one later on. All right, so let's give a summary of the alphabet findings before we move on. Learning the alphabet principle using plain letters associated with a picture beginning with that sound is more effective than no picture, but results in the least effective learning compared to other alphabets. Using pictures with letter shape superimposed into the picture showed significantly better learning of letter names and letter sounds. So now if the shape looks like the sound, that's helpful. When the printed letter was additionally placed next to the letter shape and sound combination, the learning was significantly better and generalized to the print alone better. The next attempt to support the learning of the alphabetic principle is by improving phonemic awareness using speech sound associations. Learning the associations of letters to sounds is one critical component for acquiring the alphabetic principle. The next attempt to support the learning of the alphabetic principle is by improving phonemic awareness using speech sound associations. Learning the association of letters to sounds is one critical component for acquiring the alphabetic principle. So we just look at some of the alphabets for that. But equally critical for learning the alphabetic principle and decoding the letters in written words is to recode them into spoken words, and that's called phonemic awareness. One approach for improving phonemic awareness is by associating photographs of lips producing the sounds. This program was developed in 1969 as Auditory Discrimination in Depth, or the ADD program, by Charles and Patricia Lindemood. It was revised to its current version in 1998 and renamed the Lindemood Phoneme Sequencing Program for Reading, Spelling, and Speech, or LIPS, by Patricia and Phyllis Lindemood, mother-daughter. So these are some examples of the drawings of the lips used by the Lindemood program. And you can think back to that diagram that we looked at earlier. That first picture shows the tongue tip elevating behind the teeth. And then we have a nasal sound. We have the lips with the air popping the air out. We have air traveling between the teeth. We have, different types of gestures in the speech that correspond with the sounds that people make. The basic principles of lips is that speech gestures can be used to make children aware of sounds and to cue how to manipulate them for reading, spelling, or speech. Consonants are grouped according to speech production features, using categories such as lip poppers, p or b, tip toppers, t, d, or wind sounds, w. So you can see the mouth gestures and make the associations to the different kinds of sounds that are produced with those lip shapes. Vowels are associated with mouth position features that are named things like rounds, smiles, or opens. So you can look at the picture at some of them, some of the lip gestures that you would classify as rounds, smiles, or opens. Now the manual systematically introduces the letters through phases. So you have initially letter and letter sound recognition. Then you have combining sound sequences using colored blocks to represent various syllable patterns. So they're not using letters of the alphabet, they're using blocks to represent sound patterns. Then you have manipulating letter tiles for spelling and reading syllable practice. So now we have actual little tiles with letters, alphabetic letters. So you start putting the letters with the sounds. And then finally generalizing the text to real reading. As we said, this program has been around for a long time. There are minimally 48 studies using Lindemood across the age span from pre-K through adults. And we're just going to highlight a couple of these studies. Torgerson et al. Provided intervention to 112 low-performing first graders for 1 year. Half received LIPS and half received a computerized program focusing on spelling and writing. Both performed significantly better than controls with no supplementary instruction. So this suggests both decoding and encoding are effective in establishing alphabet. So decoding would be sounding out words and encoding would be spelling words. And both of those processes improved reading skills and alphabet skills. There was no advantage to the speech production cues from LIPS. They were equal to the other program. Torgerson also provided intervention to 8 to 10-year-olds with severe reading disabilities. He was using the original version of LIPS, so the ADD program, and he compared that program's progress to a phonics program. Both programs provided one-to-one tutoring on phonemic awareness, decoding, spelling, and writing. Both groups made significant improvements in reading that were maintained 2 years later when they scored in the average range. So again, LIPS with its cues to speech production was as effective as a different phonics program, but didn't show any particular advantage. McIntyre provided LIPS training to a whole class of first graders for 1 year. Those scoring in the lowest 25 percentile at the beginning made the greatest gains compared to the average students and scored in the low average range by the end of the year, indicating they were catching up to their peers. So nothing else was compared with LIPS, but the children who were performing lower in the class did make great gains. Airy and colleagues conducted 2 studies with pre-K and K children. Both showed significant gains in phonemic awareness, spelling, and word reading tasks compared to the no treatment controls. But the gains were not greater than the group with an alternative treatment. So again, we have another study where LIPS made as much gain as another alternative program also designed to improve reading and phonemic awareness skills. So what can we conclude about LIPS? So it has been examined in 48 studies across the age band from pre-K to adults with mixed results. The results of most studies showed significant gains in phonemic awareness and decoding skills compared to a no treatment control group. However, the gains were not significantly greater than groups receiving alternative treatments. Many of the treatments were administered across long periods of time, such as an entire school year. The manual indicates the LIPS program is a long-term intensive intervention. The program developers recommend that instruction last 4 to 6 months for 1 hour a day, or 4 to 6 weeks for 4 hours a day, or minimally 100 hours of instruction. Boyer and Airy suggested the mouth production pictures serve to bootstrap neurological links between the letter representations or graphemes and the sound representations or phonemes. And this is one of the reasons that they believe that LIPS is effective. However, LIPS does not have any component for teaching graphemes other than presenting plain print letters during the phonemic awareness training. And that's one of the weaknesses of the program. Learners must use rote memory to link the phoneme awareness generated by the mouth position pictures to their respective letters. This challenge takes a protracted period of training and renders the results good, but no better than other valid interventions. The alphabets that we've tried so far and the phonemic awareness that's gained through LIPS have not quite solved the problem. So what is missing? Letters drawn in the shape of an object make an association to the word. So this would be D is for dog. But it doesn't make an association to the speech sound, so that's not very effective. Phonemic awareness is required to isolate the first sound from the pictured word, a skill that is deficient in most poor decoders and children with dyslexia, so they don't really benefit from the traditional alphabet. LIPS makes children aware of speech production cues that may help with the phonemic awareness issues, but it does not provide an association with letter shapes. Shapes formed to make letters are successful in eliciting sounds, but do not generalize to letters without pictures unless they are learned with an accompanying print letter. A missing link exists between associating print letters with sounds without phonemic awareness, and phonic faces may be that link. So how can phonic faces form a link? Well, we'll look through that same list of issues once again. Letters drawn in the shape of an object make an association to the word. Well, the object in phonic faces is a face, producing a speech sound, so it does not require learning any word associations. So when we look at a phonic face, the association is to the speech sound. So the speech sound is now represented by the alphabetic letter. When we look at the letter P, the line on the P signals a closed mouth sound. So you'll stop the air from moving through your mouth, and then the curve on the P represents use your top lip to pop the air out. So you close your mouth to stop the air and then pop the sound out. So we don't have to make any association to P is for puppies or pumpkins or anything because the association is to the speech sound cue. Phonemic awareness is required to isolate the first sound from the pictured word, but since there is no pictured word, phonemic awareness is not required. Instead, the face directly cues the phoneme associated with the letter. So you don't have to have phonemic awareness in order to understand phonic faces if you're a child who's learning to read. You just have to imitate what the face is doing. And this actually helps the child to acquire phonemic awareness. Lips make children aware of speech production cues, and so does phonic faces. The letter is drawn in the mouth of the face in a manner that cues the speech production, perhaps more directly than the lips pictures. Shapes formed to make letters are successful in eliciting sounds. So if the shape of the letter looks like an S, then it's successful in eliciting the hissing snake sound. Since the printed letter of the shape in the phonic face is positioned to represent speech production cues, there is no need to generalize to print. You just imitate the sound that the face is making, and you're also making the face and the sound. A missing link exists between associating print letters and sounds without phonemic awareness, so phonic faces may be that link. All right, so let's learn a little bit about phonic faces. In phonic faces, consonants are represented in the faces of kids. So those are some of the phonic faces, kids. Like lips, attention is focused on the mouth and speech production cues. Unlike lips, the printed letter cues the speech production. The letter B represents the bottom lip bouncing down to produce the B sound. So there's an example of a face that has the letter B drawn by the bottom lip. And there's the phonic face. Now I have the kids touch their bottom lip when they see the letter B and just bounce it, B, B, B. Each face has a storybook that emphasizes the relationship between the letter placement on the face and the sounds that it makes. So those can also be helpful in helping the children establish the sound. When developing the alphabet, I was very surprised to discover that each letter actually looked like the most relevant speech production feature. The letter M actually looks like the Cupid's bow on the lip. So there's a little boy, and the letter M fits nicely over the Cupid's bow on his lip. And so that it signals, what sound the M should make. The letter T fits an upward tongue that touches the teeth. And so it's the back of the teeth that it's going to touch, but it represents that elevated tongue and teeth line. Similarly, with sounds with open versus constricted air, the H is an open air sound where he's running and huffing out the sound. And the is constricted air. So you can see that she's using her teeth to bite her lip, which you do for the sounds F and V. In the F, it's the quiet sound. And so you're just pushing out under your teeth a very soft, quiet sound. So if you were going to develop phonic faces, let's see how good you would be at it. I'm going to give you a letter and you tell me how you would use the letter to represent the production of the sound. Ready? How would you do a letter B? We saw that one, bottom lip. So the line says, close your lips, and then the B says, bounce, ba, ba. What about letter D? Letter D is a noisy sound. So it's like a drum sound, duh, duh. The line on the D represents the drumstick, and the circle on the D is inside the mouth. And so it is basically the drum that's being drummed, da, da, da. The drumstick is your tongue, da, da, da. This helps differentiate reversals like B's versus D's. D is inside the mouth and it's the loud sound, da, da, with your tongue. And the B is the lip on the outside of your mouth, and it bounces. How would you represent a G? Okay, a G is toward the back of your mouth, and it's a voiced sound. So you actually turn on your voice, g, g, g. I have children feel their throats and they can find those G's going down their throats. G, g, g. You'll notice that G has a J in her ponytail. That's because sometimes the G can also make the J sound. So generally, G says the G sound as in girl, but it can say the J sound as in gel, G-E-L, gel. So what makes the J sound? How would you draw that? Again, think of your speech. Where does the sound start? Well, it starts up by the alveolar ridge, and then it glides down. The jaw drops and glides it down. So this is a puppet where it starts high and then the puppet's jaw drops as he's talking. Ja, ja, ja. What would you do with a K? The K is in the middle of the mouth. So the tongue starts in the middle of the mouth and it releases the sound. So it's like a little mouth cough. What about the letter L? L is one that it's a tongue tip elevation right behind that alveolar ridge again. Oh, oh. What about M? We've seen that. It's the Cupid's bow on the lip. By the way, the letter names, Emmett, Elton, the first syllable is the letter name. Katie, J, G, G, Deidre. Okay, so the letter name is associated with the child's name. There's NS, so the N is the nasal sound. What would you do for a P, the top lip? R, how would you write an R? How would you draw an R as a speech production? What is your tongue doing when you produce an R? Well, it's very fascinating because it really is in the shape of an R. So your tongue has to kind of hump and tip upwards when producing a good R. And that's the shape of the R. S is the snake, as we've seen in the other alphabets, but this time it's inside the mouth. T, you're going to extend your tongue upward, touch the back of your teeth. V, it's another sound where you bite your lip a little bit, let the air vibrate below the teeth. W is a lip waving sound. Wah, wah, wah. So the up and down motion of the W looks like lips waving. Wah, wah. Y. How would you represent a Y? The sound is close to a yawn. And so if you have your hand in front of your mouth, it's going to look very much like a Y. Yeah, yeah, yeah. And then Z is the bees that are buzzing around, giving him that sound. Okay, digraphs are going to have their own faces. Anytime there is a new concept, it needs its own visualization. So C sneezes the H out of his mouth. Sh. S shushes the H out of her mouth. Shh. TH pushes the H out of his mouth with his tongue. Because vowels are not produced with the tongue or teeth, but rather shifts in the size and shape of the oral cavity, their sound productions are difficult to see or feel. Therefore, the letter sound association is cued by a general mouth position plus a relationship to events where the sound is made. So the short vowels, they're babies. Babies are short. So when we look at this example of the short vowel baby A, and we're going to look for an association to an event, the event is being sad. And so the baby cries, ah, ah, wide open mouth. When babies begin to teeth, they open their mouths slightly and make the eh sound. Eh, 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 eh. So it's a single tooth sound. When babies don't like the taste of something, they say eh, eh, eh. We say babies don't like carrots, and so they go eh. When the doctor checks your throat, you open wide and you say ah. The doctor can see your uvula, that little flap hanging in the back of your throat. Ah. Baby U is very smart. When she thinks, she points to her head and says, ah, ah. In contrast, long vowels are the parents of the babies. The adults are long or tall. The adults look like the parent of the baby represented by the same letter. Their association to sounds are similar. So while baby A is sad and cries, Miss A is happy and says, A, as in yay or good day. So we have the association of the faces looking like each other. They do look like they possibly could be parent-child, and they have associated stories. Sad baby, happy mom. Baby E got his first tooth and says, eh. Mr. E has all of his teeth and spreads his lips wide to make the E sound. Baby I didn't like carrots and said, eh. Miss I didn't like carrots, and now she has to wear eyeglasses because she didn't eat enough beta carotene. Baby O took care of his throat so he can be a singer like his dad and make the perfect O operatic note. Oh. Baby U is very smart. So is her mother. Miss U can tell you all of the answers. And then we have baby Y. Baby Y doesn't have his own sound. He borrows either the long I sound in words like sky, buy, or try, or the long E sound in words like funny, puppy, or silly from the grown-ups. You can see the letters in his cheeks. All right, I'm going to move quickly through some of these studies on efficacy of phonic faces. A study by Pam Terrell showed that they can be learned by 20 to 24-month-old toddlers. She had 8 20 to 24-month-old toddlers that read Phonic Faces alphabet books. Each group, following their 6 weeks of instruction, had significant gains in 7 measures under the Phonic Faces conditions, and these included letter identification, letter discrimination, and sound production. The gains that were made by the first group before they went into 6 weeks of no treatment, just playing, were maintained after that 6 weeks. Another study with really young ones was by Alicia McGinnis, who showed that words where the first letter is a phonic face can be learned by 25 to 34-month-old toddlers. So these were word cards. You can see that the letter is represented by the phonic face. The rest of the word represents the meaning of the word. So the shapes of the letters, or the letters, are drawn into the shape of the word meaning. So it's both sound and meaning driven. More sight words were learned under the morphophonic condition compared to the plain print condition. Most subjects also identified the letters in plain print that they were exposed to. These findings suggest phonic faces can enhance sight word learning as well as the alphabet. Now remember, I told you to recall that study about book reading where they tried to teach the parents to refer to print and sounds, and the parents really did not do it independently, and the children did not improve. The Phonic Faces books naturally make you pay attention to print. So it says zoom back to your hive, and then there's the letter Z in print, and they're making the sound. Zzz. So as you read the book, you naturally keep talking about the letters and the letter sounds. Um, and then there are words like Zeke and Zoom, etc., throughout the story that have the letter Z in them. And so you talk about those with the child as well. So anyway, there was more print referencing by both the children and the parents when the Phonic Face books were read. Following one 5-minute training session, both the adult and the child behaviors were significantly higher for the Phonic Faces books. You can see the big differences on the graphs. Patricia Brazier Carter Minnis conducted a larger parallel study with the Head Start teachers. These were 4 Head Start teachers receiving 4 training sessions where they were learning to talk about vocabulary, phonemic awareness, print, and narrative parts. Anyway, both groups read the books daily for 6 weeks with 5 repeated readings of each. The results showed significantly greater gains for teachers of Phonic Facebook reading interactions, and then significantly greater gains were made by children in the Phonic Face groups in vocabulary, not just the print awareness, but also vocabulary, print concepts, and phonemic awareness. So you get more bang for your buck if you're reading the book and dealing with both meaning and structure as well as the phonemic awareness in print. Brinkley, Hoffman, and Norris conducted a study with 15 kindergartners. 5 worked on skills training, 5 worked on the same skills in a Phonic Face book, and then 5 served as controls who received picture book reading. And results showed both treatment groups made significantly greater gains than the controls. Brinkley, Hoffman, and Norris conducted a study with 15 kindergartners. 5 of them read Phonic Faces books, 5 of them read a Write Group book, and 5 of them got direct instruction on phonemic awareness and print. Results showed that both treatment groups made significantly greater gains than the controls who were reading the storybooks. Phonic Faces gain scores were greater than the direct instruction, but not significantly so. The conclusions were that the phonemic awareness skills can effectively be learned in a storybook context, as opposed to that previous study. In another study, 1st grade teachers were taught to use Phonic Faces in 1st grade. The results showed significantly greater gains for Phonic Faces classrooms compared to controls. More children had reached their benchmarks, and none were in intensive intervention by January for the Phonic Faces group compared to the controls. Other Phonic Faces studies included those that looked at sight words for low readers in 1st through 4th grade. Another study, significant gains were made by 23 10 to 13-year-olds on 3 phonic patterns following 8 instructional lessons. Another used Phonic Faces with preschool-age children with autism and compared learning in response to plain picture words. Both children made greater gains with the Phonic Face words and produced words within the first few sessions. So that was a cool finding. They actually started to talk. AC, non-readers made significantly greater improvement in letter names and sounds and word positions and word recognition and reading. Another study, 4-year-old Artic subjects made significant gains in articulation and emergent literacy skills. And finally, 8 preschoolers with moderate articulation delays made significantly greater gains in letter-sound relationships, letter naming, and speech sound accuracy during daily probes and storybook reading. So a lot of these studies are showing some really nice outcomes. Recently, our focus has switched to decoding syllable types. Once the alphabetic principle is emerging, beginning readers learn to blend letter sound sequences. So we have gone from individual alphabetical letters to try to sequence those to hear a word. This is a prolonged process with stages described by Linnea Airy. Blending letter sounds is challenging because we do not speak as a series of sounds such as k, up. Instead, we speak in overlapping speech movements that shift to accommodate surrounding sounds to smoothly transition between the sounds. Another big complication is that there are only 5 vowel letters to represent 16 vowel sounds, plus all of the R-controlled vowels in most dialects. So to differentiate those, English uses a variety of spellings or orthographic patterns, using a silent E or a double vowel pattern to shift the vowel sound from short to long. All right, so we're going to talk about 2 of our ongoing studies involving a multiple baseline single subject design. The first thing we need to look at are pseudo words. Pseudo words are make-up words that fit the patterns of actual English. So they're possible words, they just aren't real words. Those are used for testing because you don't want children to just recognize sight words. You want them to show you that they are decoding. So these are examples of a short vowel sequence. So it's blep, bulb, laughed, pocked, and had. So the student not only has to get the vowel correct, but also the surrounding consonants, which could involve digraphs or blends. Okay, so basically the probe at the end of every single day involved 10 of each kind of word, and I'll show you why in a minute. 3 participants were taught the short vowel pattern for 5 weeks using words that were both real words and pseudo words, but not the pseudo words that were on the probes. They were different words. When they were taught, they were displayed using phonic faces. So these are the PowerPoints that were used, examples of the slides from PowerPoints that were used to teach them the actual decoding process. And so the adult would work with them and help them pay attention to the cues until they could decode the words correctly. And on week 6, a 5-week intervention was introduced for the long vowel pattern. So we're going to shift from short vowels to long vowels. Learn a different pattern. Okay, so Chantal Farakhana study intervened with 3 7 to 8-year-old students with persistent decoding deficits. All 3 subjects showed similar patterns of learning. The graphs for the 3 7 to 8-year-olds with persistent decoding deficits were similar. Subject 1 followed the predicted pattern. The baseline showed all 3 patterns showed 30% accuracy or less at the beginning. So they could do some of the 10 words for the short vowel, but really got 1 or 0 for the long vowels. They really did not understand the long vowel patterns at all and were very poor at the short vowel patterns. But then the blue line shows that as soon as we use the phonic faces to teach those patterns, the short vowel patterns, the child's score went from 30% accuracy to 80% accuracy within a few sessions, actually within the first session. And a few sessions later to 100%, while the untreated CVC and CVVC and silent E orange patterns made minimal changes. So only the ones that we worked on went up. As soon as we use the phonic faces to teach the concept of the long vowel during phase 2, so remember we were going to teach the short vowel pattern and expect that that was the only pattern that would shift. Then we're going to introduce a long vowel pattern and expected that one long vowel to shift. However, as soon as we use the phonic faces to teach the concept of a long vowel, the trained silent E long vowel pattern in orange did quickly rise to mastery, as expected. However, the gray line or the double vowel rule also started to shift within a few sessions. So by the end of that cycle, the gray lines also were showing mastery or near mastery. So it appears that once the short long vowel contrast taught by the baby versus the adult vowel pairs was understood, the pseudo word decoding accuracy generalized to both of the long vowel patterns. Discussion. Robust significant changes by all 3 subjects for both short and long vowel patterns occurred as soon as their respective intervention phases were initiated. just as you would hope. The 10 unique baby and adult vowel faces appeared to provide a visual that enabled the subjects to distinguish between, remember, and differentially apply the 5 short vowel sounds and their corresponding long vowel sounds to the CVC, CVVC, and CVCE syllable patterns. However, some gains in untreated long vowel patterns also occurred during a phase when they were not treated, suggesting that unexpected generalization of learning occurred across these patterns. For example, once the long vowel phonic faces were introduced, meaning the adult long vowel face was contrasted with the baby, improvements were shown for both the trained and the untrained long vowel patterns. The subjects had received reading instruction in school for at least 2 years and thus had been exposed to the concept of long and short vowels, but had never understood them well enough to accurately decode. Once the concepts were visualized, they were able to access this prior knowledge and apply the concepts without explicit training. So we got some nice generalization. In addition to developing well-established concepts for vowels, the subjects were also mastering consonant patterns during training. The long and short vowels used in training were embedded in similar patterns of 2- and 3-word consonant blends. The subjects had scored very low on their knowledge of consonant blends at pretest. However, once the consonant patterns were learned using phonic faces in the CVC words, they generalized quickly to long vowel words, resulting in unexpected gains without additional training. The total of 40-minute intervention sessions resulted in mastery of 3 different syllable patterns following only 20 hours of instruction compared to the minimal 100 hours for LIPS training. The study by the second student is in progress, but the results look very similar. All right, everybody, thank you for listening today. If you would like to try phonic faces, you can download a free PowerPoint at the elementary.com site. Elementary is spelled with the word mentor embedded in it, as in materials that mentor. I hope you enjoy it. Let me know how they work.